Hey guys, Dr. Joseph Bogart here. I'm here to talk to you today about some products that we carry in our office that are very helpful for specific musculoskeletal conditions. Today I'm going to be focusing a lot on things like hip, labrum issues, knee and meniscus issues, disc issues, as well as arthritic issues that affect people. A lot of people come to my office and they have pain in their lower back or SI joint areas, which is very common for chiropractors to help with, but occasionally there are times where that's not necessarily the case and that there's actually a labral tear, a hip arthritic issue, or something that's referring to the lower back on one side, typically what feels like the SI joint. I know I personally had an issue with this and I had a torn labrum in my hip that was aggravated by hyperflexing or bringing the knee up to the chest. And when you do that, it pinches that hip and that labrum, especially if you have what's known as a CAM or a pincer lesion, which can be identified on an x-ray or an MRI. So most people say, all right, well, I have a hip issue or a tear. What do I do? What are my options? The options are as follows. There is PRP injections. Some people do well with it, some people don't. There's stem cell injections, which come from amniotic fluid. Some people do well with those. And then, of course, there's inevitably surgery, and some people do well with that. Oftentimes, it's followed up with an additional surgery years later, and oftentimes it's followed up with a hip replacement later on. Those are the more invasive routes, and what I found is that sometimes the less invasive routes seem to work a little bit better. So I'm going to mention 3 different things that you can do that are non-invasive, that are very easy to do, that are low side effect, that can help restore, heal, and reduce a hip labral tear, arthritic changes, as well as these same things can be applied to disc stenosis issues, disc issues, herniations, bulges, meniscus issues in the knee, torn ligaments in any joint in the body, or even bone spurs like in the foot if you get a calcified heel spur, something like that. So there's a product called WEI, W-E-I, you can look them up online, and they have these products known as WEI patches. And WEI patch is a combination of an herbal formula that you wear directly on the skin that penetrates in the tissue, and it stimulates the microcirculation. See, most people in chiropractic and orthopedics understand that cartilage and ligaments, particularly cartilage, tends to have a very poor blood supply, and that's one of the reasons why it takes so long to heal. So these patches actually stimulate a localized microcirculation increase, which allows good products to get in to heal the tissue, and it removes waste products in order to fix them. So that, along with some combined herbs that you take orally, known as LC Balancer, which helps stimulate microcirculation on a systemic level, also helps to do kidney elimination for the metabolic waste out of the body, that seems to work really well. Depending on the severity of the issue, it can take 1 month, up to 3 months, sometimes up to 6 if it's a very severe case. But most hip issues or knee issues can take anywhere between 1 to 3 months to do. It's not incredibly expensive, although it's not cheap, but it's definitely less expensive than, there's no recoup time like surgery, there's no rehabbing, and etc. So they're very effective for that. Something else that can be added in with that, I wouldn't say in lieu of, but in addition to that, is a laser. In our office we have a class 4 laser. Class 4 lasers do photo stimulation of the tissue, and it only affects damaged cells, and it speeds up the metabolic production of those cells to heal the tissue faster, and it only affects damaged tissue. So normal cells aren't going to be affected by it. So it's very effective, very safe, no side effects, and that's another thing to help speed up the healing. The third thing that I'm going to mention is something that works on a similar principle to the WEI patches. It's called a Bemer device, B-E-M-E-R. You can look this up, and this is a PEMF mat, as well as there's spot things that you can put on different areas of the body that are spot concentrated. And what those do is they increase a systemic microcapillary or microcirculation to the body. Again, they're finding now that circulation is the key. If you can increase the circulation to tissue, you can stimulate and increase its ability and speed of healing. So these are the 3 things that some of my patients do in combination, all 3, some do 2, some do 1, and do great with that. I myself had a hip labral issue. I was able to correct it after having an MRI and seeing the damage and having a CAM and pincer lesion, which is osteoarthritic degeneration that with hyperflexing tore the labrum, created a great deal of pain in the hip as well as in the lower back. I thought it was actually a lower back issue, and it turns out it was my hip. I was able to fix those with the WEI patches, class 4 laser, and I regularly continue with the Bemer device just for overall health, and if I have a flare-up, I'll put it on that area, as well as if I have a knee issue, etc. So those are the 3 things that I recommend to patients that I work with, are the WEI products, the class 4 laser, and the Bemer device. All 3 seem to really increase the microcirculation and enhance the ability of the body to heal. Now, I also, obviously, as a chiropractor, recommend making sure that there's no nerve interference and that the brain can communicate with all the body parts the way they should by making sure that their spine, pelvis, and extremities are adjusted and aligned in a proper manner. That being said, I'm talking about other things today, and I'm focusing on those as far as ancillary devices, therapies, etc. So that's it. If you have any questions, you're welcome to call our office at 954-340-7545. And again, I'm Dr. Joseph Bogart in Parkland, Florida. I thank you for your time, and I hope that was insightful and helpful. Bye-bye.